Master, let's now applause. Let's now receive with exhilaration our Toastmaster Akanji Abdul Azeez for his speech fighting against the fighter. You have the floor, my dear Toastmaster.
Thank you very much, the Toastmaster of the day. We have 12 months in a year, and October has been chosen as a pink month. A pink month means a month whereby the fight against breast cancer has been designated. This month was chosen globally to educate people about breast cancer. Good evening, distinguished listeners. As I said, the topic I want to discuss about is fighting against the fighter. The fighter here is breast cancer, and we need to fight together against breast cancer. Breast cancer is a disease in which the cells in the breast grow out of control. According to scientists, we have more than 30 trillion cells in the body. But when the cells in the breast goes out of control, that is when the females developed the breast cancer. According to the World Health Organization, more than 500,000 women are killed because of the breast cancer, which means my sister can be dead, my wife can be dead, my mother can be dead, my friend can be dead. And if care is not taken, we lose people we cherish enough because of this deadly disease. 90% of this disease can be cured if seen at an earlier stage. But most of these people that are killed because of breast cancer, they are seen at a later stage of the growth. That is why they are killed because of this disease. It is advisable by doctor that women supposed to do self-examination of their breast every month for them to detect this deadly disease. But the question remains, how many women do the self-checkup monthly? Most women don't do the self-checkup because they are not aware of the disease, and we are in the responsibility to tell them what they're supposed to do. In this century, I think the best for us is to advocate, educate, and inform our females about this disease and how they can prevent this disease. The symptoms of this particular disease, number one symptom of this particular disease is a swelling breast. When a woman tries to discover a swelling part of his breast or of her breast, it's better for her to visit a doctor for a checkup. The number two symptoms of this disease is the color of the breast change completely, possibly reddish color to another color. So, as a female, when you discover that the color of your breast is changing, it's better for you to check a doctor. The number three symptoms of this disease is the nipples of the breast malformate, change in forms and change in color. So it's better when you see some strange visitors in your breast, it's better as a female to please visit a doctor to know the next action to take. Because when it is in an earlier stage, it is curable by preserving the breast. But when it is seen at a later stage, it's very dangerous for the female herself. But how can we prevent breast cancer? This is a question most females ask themselves. Truly, we know the symptoms, but how can we prevent this disease? Because it's a fighter in the body, and how can we prevent it? Then one way to prevent is do sports. Females need to be actively involved in sport at least 30 minutes per day. When your body is actively and physically fit, the cells will not find a way to condense into a place to the state that it will create a disease. The second thing is avoid alcohol and eat fruit most time. You see, eating a nutritious food or taking fruit every day by avoiding too much of alcohol into your body will prevent you against the danger of breast cancer. Some doctors say zero alcohol into the body, whereas some doctors say reduce the rate of alcohol into your body. That is the second way of preventing breast cancer. The number 3 ways of preventing breast cancer is avoid contraceptive pills when you are 35 years old. The problem is that most men, when they are 35 years, they don't want to give birth again. So they take contraceptive pills. So taking contraceptive pills at 35 years old is very dangerous for a woman because it can create or it can bring the breast cancer into the body of that particular female. So according to the doctor, it is very bad for a female to use contraceptive pills at the age of 35 above. So the next way to prevent breast cancer is breastfeeding. When a female breastfeeds her children, she can prevent the breast cancer through that method too. We have many ways to prevent breast cancer, but because of my time, I can see the timer showing me the time. Because of the time, I would like us to educate females around us about the danger of breast cancer and how to prevent this breast cancer and how, especially on how to do self-examination of breast cancer every month. Thank you very much, distinguished listener, for listening to me.
Thank you, Master Akanji, for this very for your speech that I really appreciate. Thank you for contributing to the sensitization on breast cancer and do the promotion of the Pink Month. And during your speech, I hear some method in order to prevent breast cancer. I'm quite suspicious because I have worked on this theme a couple of years ago, but I think that maybe later you could give me the different sources. But the thing that I could say that the better manner to prevent, there is no better manner to prevent breast cancer. The only way to have, to be sure to avoid is to do autopalpation verification of this breast. When you see that there is something, this is wrong, directly go to hospital and do breast scanning. In French, I think like this is the same word, the mammography. So currently there is some promotion about the cost of the mammography. I encourage you, all of the women present in this meeting, to go and do the mammography because this is very important. A couple of days I saw a video of one of my colleagues who had this disease at 22. Yes, at 22. So there is no age. Please go and do your screening. This is very important for your life. Thank you very much, dear Toastmaster Akanji, and I hope in the couple of minutes, your evaluator will give you your evaluation. So now, in order to give a lot of time again to the speech evaluator, our second speaker, we will go directly at the table topics in order to permit him to have time to prepare his evaluation before the evaluation phases. So now, I would like to call on the floor the fantastic woman,